Good morning. Dr. Greg here again with another video, and I'm going to continue on my low back pain and standard of care. Now, the last video I talked to you about how research is showing that chiropractic is one of the better forms of therapy for low back pain. Much more efficient, and that the standard of care should be if someone comes in to the medical office with low back pain, they should be referred to a chiropractor right away before anything else. At least give the chiropractor a couple of weeks to see if they can resolve the low back pain. If not, then let's look into it deeper. So low back pain and chiropractic, it's a no-brainer. Now, here's some more evidence about how effective low back pain can be treated by chiropractors. And not only that, but cost effective. Now, many of you have insurance, and when you see a chiropractor, you have a copay, and you've noticed that your copays are creeping up. They're getting more and more expensive, and the insurance company is paying less and less for chiropractic. And there's lots of limitations. You're only allowed 12 visits a year, that kind of stuff. That actually may be counterproductive. And I'm going to read research from Journal of Manipulative and Physical Therapeutics. And this research is about the cost effectiveness of low back pain. I'm just going to read the summary to you. Low back pain initiated with a doctor of chiropractic saves 20 to 40% on healthcare costs when compared with care initiated through a medical doctor, according to the study that analyzed data from 85,000 Blue Cross Blue Shield beneficiaries in Tennessee over a 2-year span. 85,000 is a lot of data points to look at. No study, not many studies, don't even come close to that number of individuals. So it compared the cost of chiropractic care to MD care to 85,000 individuals. And they noticed, or they figured, that it saved 20 to 40% over the traditional care of low back pain. Now, the study population had open access to MDs and DCs through self-referral, and there were no limits applied to the number of MD, DC visits allowed, and no difference in copays. So the copays were no different. The number of visits were, so there's no limitation on anything. What they discovered then is that researchers estimated that allowing DC-initiated episodes of care would have led to an annual savings of $2.3 million for Blue Cross Blue Shield in Tennessee. They also conclude that insurance companies that restrict access to chiropractic care for low back pain treatment may inadvertently pay more for care than they would have if they had removed such restrictions. So restricting care to chiropractors actually may cause more than not restricting care. Because most people, when they see a chiropractor, if things are done properly, they're going to get better in a couple of weeks. Where with medicine, they go for physical therapy, they may see a specialist or two, they may have MRIs, they may have x-rays, all cost a lot of money. When we know research, and we're going to talk about this in my next video, is that where is all this back pain coming from? And it's going to be a very interesting video. So ending on that, the cost of chiropractic care for low back pain is significantly less than traditional kinds of care, medication and stuff. And then we know that the research supports the fact that you should not use pharmaceutical interventions in the beginning of low back pain. You should try a chiropractor. That should be the standard of the care. And that's something we need to look to in the future to save money on healthcare costs, is by using appropriate therapies that work for appropriate conditions. That's all I have to say about that today. And this is Dr. Greg, changing the way we look at health.